Hello everyone, today we'll see the counseling process. The counseling process is like a place through a series of phases. It is not a single process, it is a step-by-step process which is interrelated, interconnected and overlaps such as the nursing process. As a nursing process is also there is a steps of process. Nurses mechanism of labor is also there is a step of process, and same as the counseling process is also there is a series of process. The process is not a rigid entity. It is a flexible and can be modified based on the nature of the problem and person to be counseled. And uh, it has a 5 phases there. So we will see the one by one phases here. So first phase is the establishing relationship, we can say. This is the first and the main phase of the counseling process. It is considered as the foundation to the counseling process. It is an ice-breaking session during which the counselor and the counselees introduce each other and establish a primary rapport with that continue building further in the following phases of the counseling process. The establishing is a relationship may not be possible in a single session but may require the multiple session before the next phases of the counseling begin, so that the counselor and the counselees interact with each other. And in that, the methods of strategies of the counseling is a counseling, so that the counselor can be established a good and effective relationship. So he has to introduce first herself and begin the phase with adequate social skills and the ensure physical comfort and the counselee and self, and do not interrupt when the individual when she or he is talking, and listen attentively and observe the non-verbal communication. Then comes the second phase, that is the assessment. Assessment is the second phase of this counseling, is basically a data collection phase, where the counselor motivate the counselor to provide a complete information about the problem. During this phase, the counselor's job is to motivate the counselees to speak about the problems and listen to him patiently. The counselee's job is to provide all the relevant information pertaining to the present problem for which he is seeking counseling. During this phase, details information is collected from the counselee. Then comes the third phase, that is a setting goal. After assessment, we have to set the goals. So during this third stage of phase, the counseling process goal are to set the cooperatively by both the counselors and the counselee. While the setting goal, the counselee strengthen weakness, constraint and valuable and available resources must be kept in consideration. The goal could be immediate and ultimate, which direct the counselors and counselees. The further progress in the counseling process and the family finally help in evaluation of the counseling outcome. Goals set during the counseling are not fixed but are dynamic, which may help, or we can say which may change the basis on need and new information. Effective and reliable goal settings required for the following skill in a counselors. Then multi-fact knowledge related to the problems of the counseling and ability to think critically and interference drawing skills, judgment planning and management skill to segregate and differentiate the provided information, ability to teach individuals to think critically and realistically, help the counselor set feasible, reliable and achievement goal. Then comes the fourth phase, is the intervention. What intervention we are putting in that? This stage, the counseling is an operational phase. That is, the counseling is suggested the best possible options for the management of the patient's problem. This phase is affected by the counselor's own thoughts about the counseling process. The intervention will depend on the approach used by the counselor, the problems and the individuals. The choice of intervention is a process of adaptation, and the counselor should be prepared to change the intervention when the selected intervention does not work. Then comes the last, not the least, that is the termination phase, and we can say the follow-up phase. This is the final stage of the counseling process. As we know, everything is finished, then we will come in a termination phase, or we will departing each other. Where counseling comes to end, terminating phase. Termination must be planned well ahead so that the counselee may feel the comfortable at the departure of the gradually able to handle the problems independently. Some follow-up sessions may be required to help the counselees further to handle the problems independently. I think so. That was the phases of the counseling process. I think you understand. There was a 5 phase was there: establishing good relationship and assessment. Then comes the setting goals and the interventions and the termination follow up. I think you understand the counseling process. If you like my videos, like it and support it. Okay, bye bye.